Good afternoon and welcome to our second press conference for the day. We had a CRC meeting this morning and we've got something to update you on with regards to restrictions, but before that I will give the daily update which has just been provided to me. Very sadly there have been 7 deaths reported to us in the last 24 hours, and so we of course extend our sincere condolences and sympathies to the family of those people who have passed. Yesterday we had 1,639 positive cases, 1,285 came from PCR testing and only 354 from RAT tests. So we are seeing that transfer now of people moving from RAT testing back to PCR. It is more accurate and of course it's much better to find out those positive cases as soon as possible. 1,423 people recovered yesterday. We now have a total number of active cases sitting at 14,528. In terms of the hospital statistics, we have 206 people in our South Australian hospitals, so that's a bit of a reduction, certainly a massive reduction over the last 14 days. In ICU we have 16 people at the moment, with 5 of them on ventilators. I can also report to you that the numbers within SA Health who are furloughed has gone down to just 286, of which 175 are COVID positive. And so we do have a very significant reduction in the number of people working within SA Health in metropolitan Adelaide who are out of action from attending work. So that's also very pleasing. These are some of the things that we've taken into account in arriving at our position with regards to the reduction in restrictions in South Australia. Our hospital capacity is there, it is available, and the call on beds and staff is diminishing over the last fortnight since we last eased the restrictions. And so it's with pleasure that we can announce a further reduction in restrictions to take place as of 1 minute past midnight tonight. And that is that we will be able to move home gatherings from 10 up to 50. The fitness sector will move from a density of 1 per 7 metres to 1 per 4 square metres. We can message a guideline that as of Monday next week we can have 50% of people back at work. We had that work from home guidance put in place last year. Over the last 2 weeks we've been back at 25%, but as of Monday we moved to 50%. And we can also say that there will be a density change in terms of hospitality. Currently we have 1 per 2 square metres indoor and outdoor. We're going to change that density arrangements for outdoor to 3 per 4 square metres and allow stand-up consumption in that outdoor setting. So there are further gradual reductions in the restrictions. I've said right from day one I don't want to have these restrictions in for 1 day longer than we need to. We did announce several weeks ago that we would be lifting those restrictions in fortnightly tranches. This is our second lifting. The first went extraordinarily well. Our hospital capacity is there at the moment. We've got fewer numbers of people taking up those hospital beds, and that's what's given us confidence to further reduce those restrictions down. Now we'll continue to look at those restrictions ahead of the next lifting of those restrictions, which of course will occur in 2 weeks' time. I want to thank everybody who works on the COVID response committee. We've had 3 meetings this week. We feel very confident this further easing of restrictions is not going to put undue pressure on our hospital system in South Australia, but what it will do is, I think, ease the burden on households and businesses, particularly the fitness sector, the hospitality sector, the catering sector in South Australia, and of course it will drive more people back to work. When they go back to work, though, we are still very strongly recommending that people wear masks indoors now, not just in public spaces like shops, but also in their workplace when they're coming into contact. This is still a highly transmissible variant. We want to make sure that we can do everything we can to ease those restrictions but not have a second wave in South Australia. So again, with easing these restrictions in South Australia, we're urging people, anybody with symptoms, to go and have the PCR test, anybody that isn't fully vaccinated or boosted to have that shot as soon as possible, and when indoors, in that working environment, to wear that mask.
There's been a number of, you're talking about getting the PCR test, there are a number of rapid antigen test pickup points have been opened in regional areas. Why is that happening now, I guess, towards the end of the Omicron wave, and when we're asking people to actually get PCR?
Well, look, no, we still do have the ability for people to collect rapid antigen test kits. It started in metropolitan Adelaide. It has taken some time to put them in place in some regional settings. We don't want people in regions to miss out. We did change the advice a week ago, recommending that the PCR is the preferable test. I strongly believe that this is the case, and it is really pleasing to see over the last 4 days a gradual pickup in the number of people who are having that PCR test. If I look at the number of PCR tests that were administered yesterday, they were around 9,500. If I go back 4 days, it was below 7,500. So people are making that transition from the RAT test over to the PCR test. But the RAT is still part of our overall testing solution for our state. So all of those decisions are made by SA Health as to where they are needed and where our workforce is available. I think we've had the very best testing regime in the entire country, probably one of the best in the entire world. We certainly have a PCR capacity in South Australia which is the highest per capita in the nation, and we currently have the shortest turnaround time for those results. In fact, we've pretty much had the shortest turnaround time of any jurisdiction for a long period of time, and I do want to genuinely thank everybody within SA Pathology, but also our private labs in South Australia. Well, as I said, we had 3 meetings this week. We made the decision this morning. We didn't think there was any reason to delay that. People want to get on with their lives and planning, and so we are going to increase that home capacity cap, increasing from 10 to 50. We made a decision that people would love to know about that sooner rather than later, and so very happy to be announcing these restriction lifting as of midnight, 1 minute past midnight tonight. Yeah, so we have been working with the Fringe, with the festival, with WOMAD, of course, on their COVID management plans. Those meetings have gone well. I had an opportunity to have an update with Dr. Chris Leese. He's one of the Deputy Chief Public Health Officers in South Australia. And whilst I don't have the full detail, what I do know is that all of those negotiations are going very well and continuing.
What about dancing and singing at public functions?
No, look, that wasn't something that we've agreed to today. It's obviously something which remains in the mix. What we've decided to do is to ease those restrictions over 4 2-week periods. Today we're announcing the second of those 2-week periods. Obviously, stand-up consumption and dining densities and dancing and singing will be something that will be considered in future packages. But today I think we've got the balance right, lifting that home cap, which has been in place for a long period of time now, changing the density arrangements for the fitness sector, making sure that we can do everything we can to get people safely back to work, and of course lifting that density arrangement for outdoor dining and hospitality settings.
Are there any supports in place for parents whose children might be faster than contact, which makes their life a lot more difficult? The child can still go to school but can't go to school-hours care. What's there for parents who their work arrangements might be affected by that?
So the Commonwealth has a range of supports in place. I can follow up the detail of that particular situation, but they do have some basically some isolation payments that they authorise. We don't have any at the state level.
What about deficit patient care? The opposition says there's been too many. Is there enough boosters being given out to aged care? Are you concerned about the number of deaths in aged care?
Well, straight after this press conference, of course, I will be going to the National Cabinet. Aged care is one of the responsibilities of the federal government. We will get an update from Lieutenant General John Fruin, who is responsible for that vaccination program and the booster program. We will be getting an update. There was a commitment from the federal government to get back to every aged care facility in the country by the end of January, so we'll get an update on that. We do have Cassie Mason coming to the CRC next week, so we have presentations and workshops with different vulnerable groups presenting to the CRC on a weekly basis. Obviously, we're having weekly updates at the moment in terms of our Aboriginal communities in South Australia, but also next week we will be having a further update on aged care. Now, even though this is not the responsibility of the state government, I think I reported about 2 weeks ago that SA Health were working very cooperatively with aged care providers in South Australia, lending support where we can, often in a very bespoke way based upon the needs that they find themselves in at the time. So we'll get an update and we'll be able to provide further details next week.
Has the increase over the past couple of days, new case levels have increased a little bit? Was there any consideration perhaps causing the unwinding of restrictions because of that?
Well, as I've said at this meeting a couple of times, we will see fluctuations on a daily basis, but the important thing is that the 7-day average here in South Australia is below 1,400. What we know is that we have the lowest per capita 7-day average in the country outside of Western Australia, and that's only happened because of the great cooperation of all South Australians and sensible, I think, a sensible balance of restrictions that have been put in place here in our state. Now, I think that there has been a slight uptick in the number of positive cases based upon a transfer of or a movement from RAT test to PCR. We know that PCR is far more accurate, and so I think that was reasonably predictable. But the important thing is not so much the number of new infections, but the rate of hospitalisation. What we've seen is that move very significantly down. We also have now the advent of new antivirals that are coming into our hospital settings, so that we will be able to further provide a quality of care that hasn't been available there previously. We'll get a further update about that in National Cabinet today.
Statistics that show South Australia has the highest death rate per 1,000 cases in the country.
Well, I don't know what that statistic, I don't understand that.
1.2 people are dying per 1,000 cases here, which is much higher than there are
Well,
in the eastern states.
Well, I haven't seen that statistic and I don't know who it comes from, but what I do know is that our hospitalisation, our infection rate and our death rate remain very low in South Australia, certainly per capita very low in this state. So I think that that's good, but we can't become complacent about it. We've got to make sure that we're doing everything we can. Obviously, in some states where they have had waves go through previously, which have had high death rates back some time ago, they have fewer vulnerable people in those categories than in places like South Australia and Western Australia. So if you look at a small sample, that potentially could be the case. That's the only explanation I could think of off the top of my head, but I'm happy to look at those statistics. Yeah, so the COVID Ready Committee has considered that. The Police Commissioner has been working on that with the Electoral Commissioner. I think we're only a few days away from putting forward our plans that will ensure that every eligible voter will be able to have that opportunity to vote in the upcoming state election. Well, I've already addressed those matters in the previous. Not in a lot of detail. I understand that. Well, I think Rob Lucas has stood up. I think most of the issues that he raised were things which are already a matter for on the public record. I mean, some of them I'd spoken about myself in the chamber. So I think what we really need to do is now hear from Peter Mallon and ask us what is his response to his team and some of the behaviour that is alleged against him. Now, he made commitments that he would have his own investigation and follow these things up. They've been reported through the media over an extended period of time. We're only 5 weeks out from the election. We still haven't really heard from the Labor leader what he'll be doing and what action he'll be taking.
How is enforcement of restrictions going as the restrictions are unwound? Is it still within the police resources to be able to check on those things? compliance rates?
We do have a dedicated team working under an operation called Operation Limit, and they are doing regular checks on businesses in relation to ensuring compliance. Pleasingly, the overwhelming majority of businesses are doing the right thing or endeavouring to do the right thing, and we're taking the same approach that we've taken right throughout the last 2 years, and that is encouraging people to understand and comply with the directions as they impact on them, and giving people the chance to do so. So very few expiation notices have been issued. Operation Limit has been extended while we're working through the easing of restrictions to make sure that as they change, the various businesses and other workplaces that are affected by those changes are stepping into the right sort of momentum and getting it right as quickly as possible.
Are you concerned with, firstly, the level of cases that we're getting in South Australia, the restrictions that have been lifted, and the level of boosters that have been implemented in South Australia?
I think I made it clear, as has Professor Spurrier and the Premier, that there are still a large number of people who are eligible for their booster who haven't turned up to get that third injection, and that's clearly one of the tools we have at our disposal to minimise the impact of COVID on our community. We are looking at the case numbers on a daily basis, and we've been provided modelling from Adelaide University, which has informed us in terms of being able to ease the restrictions in South Australia in a way that is within the capability of the health system. So that's obviously a very important consideration for us.
What do you make of the timing of the easing of just about all restrictions 4 days before the state election?
That's certainly not one of my factors for consideration. We've made a commitment to only keep restrictions in place when they're necessary under the Emergency Management Act. That's my priority, and if there's an opportunity to release restrictions earlier than that, we will do so. And consequently, if we see that there's a significant outbreak in South Australia, I wouldn't hesitate to take whatever action is necessary based on the advice from SA Health to mitigate that ongoing risk to South Australia. So this is nothing to do with caretaker or the election. This is about managing COVID and being consistent with the way we've done that right throughout the course of the pandemic response. Thank you.